Hi, I'm Jessie, Clinical Pharmacy Specialist at the St. Cloud VA Healthcare System. Welcome to Class 2, Medications Can Help. And thanks for taking the time to consider this topic. There are many different types of medications that can be helpful in the effort to quit tobacco. In this class, we will cover types of tobacco cessation medications, nicotine replacement medications, bupropion, varenicline, medications affected by smoking, and e-cigarettes. As was mentioned, there are a variety of medications that can assist with quitting tobacco use. Nicotine is typically eliminated from the body within 2 weeks of stopping use. We use medications to make it easier for you to deal with the behavioral change and not have to worry about the physical addiction. This is why you will see that therapy is recommended for a few months rather than only 2 weeks. Some of these medications used in tobacco cessation provide small doses of nicotine to help you reduce the nicotine level in your body. These types of medications are called nicotine replacement medications. They reduce your cravings for nicotine and help reduce the withdrawal symptoms that accompany the process of quitting. Nicotine replacement medications include the nicotine patch, lozenge, and gum. We will discuss how these work later in class. In addition, there are 2 medications that do not contain nicotine, bupropion and varenicline. These can help you have fewer cravings for nicotine. Some of these medications can be used together to help you stop tobacco use. Studies show that these combinations are effective and can work better than one medication alone. The combinations include the nicotine patch in combination with either the nicotine gum or lozenge, and bupropion in combination with the nicotine patch, nicotine gum, or lozenge. Varenicline is not used in combination with any other medications for quitting tobacco. So you may be wondering, what works best when it comes to quitting tobacco? At this time, it appears that combination therapy works best. This involves using one or more of the medications along with behavioral strategies for the highest success rates. You will be learning numerous behavioral strategies throughout these classes, and you can add those strategies to medications to increase your quitting success. The medications chosen will be based on your discussion with your medical provider and determined by your medical history and preference. All the medications we will discuss can help to increase your chances of quitting for good and are available through the VA. You can contact your tobacco cessation team, primary care provider, or mental health provider if you are interested in using medications to help you quit tobacco. Let's talk some more about nicotine replacement medications. First, let's review the patch. The patch provides steady nicotine to your body, but not at a level to cause addiction. Its job is to make you feel more comfortable during the process of quitting, so you can focus on changing habits and behaviors. It works as a step-down process to slowly reduce your body's need for nicotine as you develop these new behaviors. The patch delivers nicotine into the body through the skin. It is typically applied to the skin on the upper arm, upper chest, or upper back. The patch is placed down firmly so that it will stick to your skin. It's best not to use lotion on your skin before using the patch. If your skin tends to be oily, you may want to first use rubbing alcohol to clean the area. Then, when the skin is dry, you can apply the patch. You may be wondering how much of this medication to use. If you smoke 10 cigarettes or more a day, you would begin with a 21 milligram patch daily for 4 to 6 weeks. Then you would step down to a 14 milligram patch for about 2 weeks, and finally a 7 milligram patch for 2 weeks. If you smoke less than 10 cigarettes a day, you would begin with a 14 milligram patch daily for 6 to 8 weeks, and then step down to a 7 milligram patch daily for 2 weeks. People often ask if they can still smoke when using the nicotine patch. You should try to stop smoking when wearing the patch. If you slip and smoke a few cigarettes, continue to use the nicotine patch. It helps to use the nicotine gum or lozenge for cravings rather than smoking. Other strategies may help you with cravings, such as chewing gum, eating carrot sticks, deep breathing, going for a walk, or drinking water. but we'll focus more on these types of behavioral strategies in our upcoming classes. If you do have a relapse and you are back to your original smoking habit, it is typically best to stop using the nicotine patch and contact the person who prescribed the patch. They can discuss the best steps for setting another quit day and restarting the patch when you are ready to quit completely. As you think about this option, it's important to review the possible side effects. The patch can cause itching or rash in the area where it is applied. If that occurs, you could put the patch on a different area of skin each day. Some people experience nausea or dizziness if the dose is too high, and this should be discussed with your tobacco cessation team. Another possible side effect is difficulties with sleep or nightmares. If this happens, it may help to remove the patch before you go to sleep and place a new patch upon waking. The patch is a good option to use when you need a gradual decrease in nicotine levels in your body. However, it is not good during situations where you utilize behavioral strategies already and you still have cravings and urges. This is where the nicotine lozenge or gum comes in and helps with those additional behavioral triggers as well as nicotine withdrawal symptoms you may experience. If you choose to use nicotine gum or lozenge, nicotine is delivered to the body through the lining of your mouth, similar to the area where chewing tobacco is placed. So the question is, how much do we use? When using these products by themselves, the recommendations are as followed. If you smoke your first cigarette within 30 minutes of waking, use the 4 milligram strength of the gum or lozenge. It is recommended to use these medications every 1 to 2 hours and at least 10 times a day when first initiating. From there, it would be recommended to try and decrease the number of times you are using the gum or lozenge each week. For example, use 10 pieces of gum or lozenges daily for the first week, use it 9 times daily the second week, 8 times daily the third week, and so on. The goal would be to taper off within 3 to 4 months of use. If you are smoking less than 1 pack a day, you would start with the 2 milligram gum or lozenge and follow the same schedule we just reviewed, however using the 2 milligram dose instead of the 4 milligram dose. As noted above, a combination of 2 medications may be more effective than 1 medication alone. If you are using the nicotine gum or lozenge in combination with nicotine patches or bupropion, you should follow the following guidelines. Use the 2 milligram gum or lozenge when you have a craving for tobacco or at a time you know you will have a strong craving. Often these types of cravings occur in the morning, so you should use the gum or lozenge right when you wake. Try to use no more than 6 to 10 pieces a day when you are using the nicotine gum or lozenge in combination with the nicotine patch. The longer you've been off tobacco, the less you need the breakthrough gum or lozenge. You can also begin using substitutes like sugar-free gum, mints, or candy between doses of nicotine gum or lozenge. It is important to note that when your nicotine patch is titrated down to the next dose, it is possible that your use of the nicotine gum or lozenge may increase as the background nicotine dose from your patch is decreased. If this occurs, slowly taper down on the gum or lozenge thereafter as you are able. Using the gum or lozenge involves some specific strategies to remember. The first thing to remember is that you don't chew nicotine gum like you would regular gum. Instead, you use the bite and park method. This means you place a piece of gum in your mouth and bite it 2 or 3 times until you get a peppery taste or feel a tingling sensation. Then you park the gum on the inside of your cheek and leave it there until you no longer have that peppery taste or tingling. Then you repeat the bite and park method several times until there is no longer any peppery taste to the gum. At this point, you would throw the gum out. Remember, I said you should avoid using nicotine gum like you would chewing gum. The reason for this is that if you use it like chewing gum, it will not allow the nicotine to be absorbed through the lining of your mouth. You will swallow the nicotine, which may cause you to feel sick to your stomach and have heartburn. In addition, your nicotine craving will not go away since the nicotine will not be absorbed from your stomach. It's also important to not combine chewing gum with nicotine gum, since this will reduce the absorption of the nicotine. Similarly, when using the lozenge, you simply place it in your mouth and put it in the inside of your cheek and leave it there. You may rotate the place in your cheek where you put the lozenge in order to reduce irritation in your mouth. It's important to not chew or bite the lozenge. It must dissolve completely to release the entire dose of the nicotine. With both the nicotine gum and the nicotine lozenge, it is important that you do not eat or drink for 15 minutes before, while using, and for 15 minutes after using the products. It's important to avoid acidic beverages like coffee, juices, soda, and alcohol during these times, since it will reduce the absorption of the nicotine from the gum or the lozenge. There are a couple of possible side effects from the nicotine gum. These include irritation of the mouth and nausea and heartburn if the gum is chewed quickly or the lozenge is chewed or swallowed. We've just reviewed the nicotine replacement medications. Now I'd like to review some other medications that can aid in tobacco cessation. Bupropion is a medication that reduces nicotine cravings by increasing the dopamine in the brain. Dopamine is involved in the addiction to nicotine. Remember, bupropion does not include nicotine, so you may still have some nicotine withdrawal symptoms. Bupropion is also an antidepressant, which can be beneficial for some people who use tobacco and have a history of depression. Your medical provider will specify the correct dosage, but here are some things to consider. First, bupropion is a tablet that is swallowed whole, so do not crush or break the tablet unless instructed to do so by your provider. This medication is started about 7 to 14 days before your quit date, so it's important to set your quit date about a week or so before you start taking bupropion. This medication is typically taken for 8 to 12 weeks, but can be used longer if needed. I'd like to wrap up this section by talking about who should not use bupropion and possible side effects. Let's start with who should not use bupropion. Bupropion can increase your risk of seizures, so individuals should avoid this medication if they have a history of seizures, a current eating disorder, or if they are drinking more than 2 servings of alcohol a day. In addition, if you are taking medications for depression, bipolar disorder, or other mental health disorders, you should discuss this with your medical provider whether bupropion will work with your current medications. Possible side effects of bupropion include difficulty sleeping, nervousness, and dry mouth, and less commonly, rash and swelling. Some people can experience mood changes, depression, or suicidal or homicidal thoughts. If you experience any of these types of mood changes or thoughts, contact your doctor immediately. If you are in a crisis, call 1-800-273-TALK or 1-800-273-8255 and press 1 to talk with someone immediately. You may also seek help online at www.veteranscrisisline.net. One additional medication we'll cover today is varenicline, or Chantix. Varenicline works by blocking the receptor in the brain where nicotine binds. This blocks the effect of nicotine when you smoke or chew tobacco. This medication also acts like a weak form of nicotine, which can help reduce nicotine withdrawal symptoms. Varenicline is not used in combination with nicotine replacement medications because it blocks the nicotine receptors, making the nicotine replacement medications less effective. Varenicline is a tablet, which can be split if necessary, and your medical provider will specify the correct dosage. It is important to always take varenicline with a full glass of water and with food to decrease the risk of an upset stomach and vomiting. This medication is started 7 to 14 days before your quit date. So it's important to set your quit date about a week or so after you start taking it. This medication is typically taken for 12 weeks, but can be used for an additional 12 weeks if you have successfully quit tobacco and feel you need longer use of the medication. Your provider will assist you with this as you move forward. With this medication, we also need to review who should not take it and what the possible side effects may be. Please consult with your doctor about taking varenicline if you have a history of depression, bipolar disorder, PTSD, or other mental health disorders, since it may not be safe for you. If you have had a history of suicidal or homicidal thoughts or acts in the past 12 months, varenicline would not be appropriate for you. Common side effects of varenicline include upset stomach, nausea, vomiting, headache, difficulty sleeping, and dream disturbances. Some individuals experience depression, anger, irritability, suicidal thoughts, or homicidal thoughts. If any of these side effects happen after starting varenicline, stop taking it and contact your medical provider or go to the ER. Again, remember, if you are in a crisis, call 1-800-273-TALK or 1-800-273-8255 and press 1 to speak with someone immediately. You may also seek assistance online at www.veteranscrisisline.net. We have discussed a number of options for medications that can assist you in your efforts to quit tobacco. As you consider your options with tobacco cessation medications, it is also important to know that your current tobacco habit can affect some of the medications you may be taking for other health conditions. Tobacco smoke affects how some medications are used and removed from your body. This means there may be lower amounts of medicine in your body when you are smoking, so that they might not work as well. As a result, your doctor may need to increase the dosage of certain medications. However, just the opposite could be the case as well when you stop using tobacco. This may also result in a need for an adjustment in your dosage. The best plan is to talk with your medical provider about any side effects you may experience from your medications after you quit smoking. Some types of medications that can be affected by smoking include antidepressants, anti-anxiety medications, antipsychotic medications, blood thinners such as warfarin, high blood pressure medications, and medications for heart rhythm problems. Caffeine is also removed from your body faster when you smoke, so you might need less caffeinated coffee or other beverages after you quit. Typically, it is good to reduce your caffeine intake by half when you quit tobacco. There is one more topic that is important to discuss when planning to quit tobacco. Some people look at using e-cigarettes as an option and think this may be a good way to get rid of their smoking habit. E-cigarettes have health risks as well, and I'd like to review a few of them. An e-cigarette, or electronic cigarette, uses a metal tube with an atomizer and a cartridge of liquid nicotine. When the user inhales, the atomizer converts liquid nicotine into a vapor that is inhaled. There are certain concerns about this delivery system. Nicotine concentrations can vary by brand, and the e-cigarettes are not regulated. E-cigarettes expose users to harmful chemicals other than nicotine, including many of the same toxic carcinogenic compounds found in regular cigarettes. The nicotine goes right into the lungs through an inhaler that is absorbed in the oral membrane. One question stands out: do electronic cigarettes help people quit smoking? Research studies have not shown an improvement in cessation rates. Other studies show that there is a potential for increase in nicotine addiction and cigarette use in adolescents. There is a lack of safety information available to know the long-term risks with e-cigarette use. The best advice is to quit for good. We have covered a lot of information in this class, and I'm sure you have a great deal to think about. At the VA, we are committed to your success in your efforts to quit using tobacco. Your facility has clinicians on your tobacco cessation team that can help you with your individual medication needs. Please feel free to contact a member of your healthcare team via secure messaging or telephone to ask your questions and find the support you need.